Hi, this is Ginger Keene, and in this program, I'm going to help fostering critical thinking through concept mapping. I provided you with my email and phone number if you have any questions. So what is a concept map anyway? It's an innovative approach to planning and organizing nursing care focused on a holistic nursing view of the patient rather than the disease model. Because the complexity of patient care situations, new nurses and student nurses need to develop the ability to respond appropriately to illness as experienced by the patient and family, to the burdens of caring for multiple patients with frequent interruptions, to information and privacy requirements, to changing levels of care, and to complex admissions and discharge criteria. For the new nurse, it helps with organizing the problems and care of the patients in a logical fashion that guides the student's focus so he or she can learn to analyze relationships in the clinical data and to prioritize the needs of the patient. For the instructor or the preceptor, it provides a visual representation of the critical thinking ability of the inexperienced nurses or student nurses. A concept map is a diagram of the sequential steps of the nursing process. A description we'll expand upon in this concept map is the sequential steps of the nursing process: assessment, nursing diagnosis, goal, intervention, and evaluation. Applying critical thinking to care situations necessarily means utilizing the fundamental problem-solving skills of nursing, traditionally expressed in the terms of assessment, diagnosis, intervention, and the evaluation of the nursing intervention's effectiveness. So let's get started. This is DJ. He fractured his right femur when he jumped off the roof. Not so smart. Although there are many different ways to make a concept map, we're going to explore one way. DJ is a 42-year-old male admitted with a fractured right femur. And although there are many different ways to make a concept map, I will show you one way to do it. Start with a circle in the center of the paper, identifying the patient. Then, to plan the patient's care, you'll utilize the nursing process. One of the challenges in the area of nursing education is the identification and use of innovative teaching methods to improve learning and critical thinking skills of nursing students. Helping nursing students learn to use sound clinical judgment has become a primary goal of nursing programs. Concept mapping has been shown to promote meaningful learning and critical thinking. Then, to plan the patient's care, you'll utilize the nursing process. So to begin, assess the patient and gather subjective and objective data. So in this picture, my leg hurts, I feel awful. When I sit up, I get dizzy-headed. Subjective assessment data, which is the information only the client feels and can describe. Signs, current health problems, such as weight, we'll say 200 pounds, and an x-ray showing a right femoral neck fracture, or objectives. Let's see how this assessment data looks when we add it to your concept map. It needs further assessment, subjective assessment data. DJ, 42-year-old male, admitted with diagnosis of right femur fracture. So put the information collected in the smaller circles around your patient primary circle. Now come up with a nursing diagnosis. Look at the assessment data and identify patterns of related responses to an actual or potential health problem, such as blood pressure 150/68, pulse is 98, patient is moaning, complaining of pain in right leg, and probably because he has a right femoral neck fracture. Acute pain based on the problem identified. Choose an appropriate nursing diagnosis from the NANDA list. Add this nursing diagnosis to your concept map. Acute pain subjective assessment data. Add the nursing diagnosis to your concept map, and you must be able to show the relationship between each nursing diagnosis you choose and the assessment data upon which it is based on. As you add more diagnoses, another diagnosis, acute pain, another diagnosis, your map can begin to look confusing, so skip the lines. Add this nursing diagnosis to your concept map and basically stating acute pain and subjective assessment data. So instead of the lines, use a 3-part nursing diagnosis that includes nursing diagnosis, which basically shows the acute pain, a cause related to the right femoral neck fracture, and indicators that provide evidence to the result in the nursing diagnosis, such as your assessment subjective data and your objective data. When added to your concept map, it should look like this. Much better, don't you think? After you have decided on a nursing diagnosis, set a patient-focused goal. That should be specific, measurable, attainable, and timely. So you'll be able to determine if desired outcomes of care are achieved. So what's going to be your patient-focused goal? He will have no pain? Not likely. He did break his leg. Pain control at a tolerable level to perform ADLs and mobility? That's more like it. How will you determine if the pain is tolerable? Pain level of 5 is specific. 0 to 10 is measurable. Within the next 24 hours is attainable and realistic and timely. Put this goal on your concept map. As you can see here. Now you need to decide on nursing interventions that, when implemented, will enable the patient to achieve the stated goal. Explain 0 to 10 pain scale, need not wait until pain is severe, administered ordered pain medications as needed, assess pain relief 30 minutes after medicine, maintain bucks traction to decrease muscle spasm, refresh ice to right femur as needed, and provide periods of uninterrupted rest. Add your interventions to your concept map. Following the same sequence of steps, you can develop additional nursing diagnosis along with goals and interventions. At this point, prioritize the needs of your patient based on Maslow's hierarchy of needs. Number each nursing diagnosis on your concept map in order of priority. 1, 2, and 3, and there possibly will be more and probably will be. Lastly, do an evaluation of the effectiveness of the interventions in relation to goal set. If goal is not being met, what changes do you need to make? Here is a completed concept map with one diagnosis, the goal, the interventions, and the evaluation. You just made a concept map. Here's a sample of a blank concept map. And you may decide to make your own or make your own template. And here are the references that I used to complete this program. Thank you very much.